Can you imagine a world where your mind constantly dances from thought to thought, where focusing on a single task feels like trying to catch a butterfly with your bare hands? This is the daily reality for millions of people living with ADHD, or attention deficit hyperactivity disorder. The first question that naturally arises is, who is at risk of developing ADHD? While there's no single cause, a combination of genetic, environmental, and neurological factors can increase the risk. It's not a respecter of age, gender, or social status. It can affect anyone. One of the most contentious issues surrounding ADHD is discipline. It's important to remember that a child with ADHD isn't being disobedient or difficult on purpose. Their brain simply works differently. Understanding and patience are key in dealing with disciplinary issues. What are the signs and symptoms of ADHD? They're often divided into two categories: inattention and hyperactivity impulsivity. These can manifest as forgetfulness, difficulty following instructions, fidgeting, and impulsive decisions, among other things. While there's no cure for ADHD, there are treatments available that can help manage symptoms. These range from medication and therapy to lifestyle changes and support from loved ones. Beyond traditional medicine, there are alternative treatments that some find helpful. These include biofeedback, yoga, and dietary changes. Speaking of dietary changes, there's a growing body of evidence suggesting a connection between nutrition and ADHD. Some studies suggest that certain foods may exacerbate symptoms, while others may help manage them. The ADHD brain is unique. It's not defective or broken, just different. Understanding how it functions can help us better manage the disorder and support those living with it. It's also worth noting the potential link between chemical exposure and ADHD. Some research indicates that exposure to certain chemicals during pregnancy may increase the risk of a child developing the disorder. Despite the challenges, many people with ADHD lead successful, fulfilling lives. There are strategies and tips that can help manage symptoms and harness the unique strengths of the ADHD brain. Finally, will ADHD ever go away? The answer is complex. Symptoms may change over time and some people may outgrow certain symptoms, but many will continue to experience them into adulthood. In conclusion, ADHD is a complex, multifaceted disorder. It can be challenging, but with understanding, treatment, and support, individuals with ADHD can thrive. It's not about curing the disorder, but learning to live with it, embracing the unique perspective it offers, and celebrating the strengths and talents of those with ADHD. Remember, it's not a disability, it's a different ability.
On one side of the ring, we have what some call the manufactured disorder approach. These voices argue that ADHD, as we know it, is not a legitimate disorder. Instead, they suggest it's a label, a construct, conveniently manufactured by pharmaceutical companies and the medical industry. They point to the adverse effects of common ADHD medications, such as Ritalin, and the uncanny coincidence of symptoms appearing right around the time children start school. They argue that we are too quick to diagnose and medicate, without considering factors such as home environment, parenting styles, or even the natural energy levels of children. On the opposite side of the debate, we have those who champion the real disorder approach. These advocates firmly assert that ADHD is a legitimate disorder rooted in brain chemistry imbalances. They liken ADHD to other neurological conditions such as depression, where symptoms persist across various life situations and are not merely a product of circumstance or environment. They argue for a balanced treatment approach, combining medication with therapy to manage symptoms effectively. And where does discipline fit into this debate? The consensus is that lack of discipline is not a cause of ADHD. However, the role it plays in managing the disorder is hotly contested. Some argue for stricter discipline, while others advocate for a more tailored approach, designed to meet the unique needs of children with ADHD. In conclusion, the ADHD debate is complex and multifaceted, with contrasting viewpoints on its origins, validity, and the most appropriate ways to support those affected by it. Whether one subscribes to the manufactured disorder or real disorder approach, the ultimate goal remains the same: to improve the lives of children struggling with ADHD. As we delve further into this topic, Remember that understanding is the first step towards compassion and better support for those living with ADHD. So whether you're a skeptic, a believer, or somewhere in between, stay tuned, stay curious, and keep seeking the truth.
Have you ever wondered what exactly is happening within the intricate labyrinth of the brain in those diagnosed with ADHD? Is there a tangible biological difference that sets their minds apart? The answer, as revealed by extensive research, is an unequivocal yes. ADHD, or attention deficit hyperactivity disorder, affects specific areas of the brain, namely the frontal lobes, the cortex, the limbic system, and the reticular activating system. Each of these regions plays a unique role in our mental functioning, and their impairment significantly contributes to the symptoms associated with ADHD. Situated at the front of the brain, behind the forehead, are the frontal lobes. These lobes are the maestros of our concentration, decision-making abilities, learning, and memory. They are the silent guides that help us focus on tasks and see them through to completion. Furthermore, they regulate our behavior and emotional impulses. In individuals diagnosed with ADHD, slow brainwave activity across these lobes is a common characteristic. Next, we have the cortex, which acts as the body's impulse control center. When functioning correctly, it reins in hyperactivity and angry outbursts. However, in the ADHD brain, the inhibitory mechanisms of the cortex falter, leading to diminished impulse control. Deep within the brain, nestled at the base, lies the limbic system. This region serves as our internal sentinel, alerting us to potential dangers and threats. A malfunctioning limbic system can lead to erratic emotional changes, unstable energy levels, irregular sleep patterns, and poor stress management. This can result in heightened sensitivity to surroundings and unpredictable emotional outbursts. Finally, we have the reticular activating system, or RAS. Located at the back of the brain stem, the RAS governs our waking and sleeping patterns and plays a crucial role in our ability to concentrate and focus. In the ADHD brain, the RAS may not function as it normally should. In light of these findings, it might seem paradoxical that stimulants are often used to treat ADHD. You might think, shouldn't these individuals be given something to calm them down? However, given the correlation between slow brainwave activity and ADHD symptoms, the use of stimulants to increase brain activity makes perfect sense. In summary, ADHD is not just a label or a condition. It is a complex interplay of different brain regions, each with its own role and function, working in harmony, or sometimes disharmony. Understanding these intricacies is crucial, not just for those diagnosed with ADHD, but for everyone who seeks to understand the fascinating workings of the human brain.
This isn't a dystopian fiction, but the stark reality of attention deficit hyperactivity disorder, or ADHD, a condition that affects millions of children worldwide. Our journey through the intricacies of ADHD risk factors begins with demographics. Boys are more frequently diagnosed with ADHD than girls, although recent research suggests that the disorder might be more widespread among females than previously believed. When it comes to ethnicity and cultural background, ADHD doesn't discriminate. It's present across all ethnic groups and cultures, being more visible in societies where compulsory education is emphasized. Next, we delve into the realm of genetics. ADHD has a tendency to run in families, yet the extent to which genetics play a role remains a mystery. It's still unclear whether the patterns we see are due to genetic factors or whether they're a result of shared parenting practices and environmental influences. The environment in which a child grows up can also play a significant role in ADHD development. Prenatal exposure to maternal smoking, drinking, or drug abuse can potentially increase the risk. Environmental toxins like pesticides and lead exposure in early childhood are other potential risk factors. Even dietary factors, such as artificial additives and unhealthy eating habits, can contribute to the risk, emphasizing the importance of good nutrition in both prevention and management of ADHD. Physical trauma, particularly head injuries, can also influence ADHD risk. Children who've experienced such injuries are more likely to develop ADHD compared to their uninjured counterparts, underlining the importance of safety measures in the prevention of ADHD. Lastly, we touch on parenting style. Certain behaviors are commonly seen in parents of children with ADHD. However, It's still unclear whether these behaviors are a result of ADHD symptoms or if they actually contribute to the disorder. Research is actively trying to unravel this complex relationship. To sum it up, identifying who's at risk for ADHD is a complex task involving a careful consideration of genetic, environmental, and social factors. Ongoing research is striving to shed light on the underlying mechanisms and develop effective strategies for prevention and intervention. Understanding ADHD and its risk factors is a significant step toward creating a world where every child can thrive.
Have you ever wondered whether your child might be grappling with ADHD, or pondered if your spouse or even you yourself could be dealing with it? It's important to understand that ADHD can manifest differently in children and adults, and its symptoms can often mirror those of other conditions. Today, we delve into a concise list of the symptoms of ADHD in both children and adults. When it comes to children, most signs and symptoms of ADHD make their presence felt before the age of 7. It's crucial to distinguish between what can be termed as normal childhood behavior and ADHD, a task best left to the expertise of a qualified health professional. Now, here are some of the telltale signs of this disorder in children. Firstly, staring off into space. Often overlooked, this is a symptom of ADD that doesn't quite fit the hyperactivity stereotype. Children who often seem lost in thought, staring out the window for long periods instead of focusing, could be dealing with ADD. Next, chronic fidgeting. While nearly all children fidget, in those with ADHD, it tends to become a compulsive, repetitive behavior that can be distracting and disruptive. If a child feels compelled to fidget, it might be indicative of ADHD. Finally, excessive talking. Children with ADHD have a propensity to blurt out things at inappropriate times, and their utterances may be inappropriate as well. Despite correction, these children seem unable to control this impulse. Now, moving on to adults, the signs and symptoms of ADHD are slightly different. Firstly, the workaholic. Adults with ADHD may be driven to work incessantly. This could be linked to hyperfocus, a somewhat ironic symptom of ADHD in adults. Next, extreme disorganization. While many adults juggle numerous roles and may feel disorganized, in an adult with ADHD, it's a chronic issue that can seriously hamper their productivity. They may be buried under clutter in their car, home, and office and struggle to overcome it. Lastly, poor time management. An adult with ADHD may feel perpetually overwhelmed, unable to manage their time effectively. Even organizing small tasks may seem like a mountainous challenge. If any of these symptoms resonate with you or your child, it's crucial to seek medical advice for an accurate diagnosis and to rule out other factors like nutritional deficiencies or low blood sugar, which can present similar symptoms. In summary, ADHD can present differently in children and adults, with symptoms ranging from excessive daydreaming and fidgeting in children to hyperfocus and disorganization in adults. Recognizing these signs is the first step towards seeking help and managing the condition effectively. So remember, you're not alone in this journey, and there's always help available.
While they're not universally linked to exacerbating ADHD symptoms, these substances can be problematic for those sensitive to them. The removal of artificial colors and preservatives from the diet has led to significant improvements in symptom management for some individuals with ADHD. There's a potential link between gluten sensitivity and ADHD. Many children with ADHD also experience celiac disease or gluten intolerance. Gluten can trigger inflammation in the intestinal lining, leading to leaky gut syndrome and systemic issues. For some, eliminating gluten from the diet promotes gut healing and alleviates ADHD symptoms. Iron deficiency can manifest with symptoms similar to ADHD, such as poor attention span and behavioral problems. It's advisable to test for iron deficiency in children exhibiting ADHD-like symptoms, and iron supplementation may be recommended as part of the treatment. Low blood sugar levels can mimic ADHD symptoms, including difficulty concentrating, jitteriness, and hyperactivity. By maintaining stable blood sugar levels through a balanced, whole foods diet, these symptoms can be alleviated, emphasizing the importance of regular meals and healthy snacks. Some families opt for organic produce to minimize pesticide exposure due to concerns about its potential link to ADHD. Reducing pesticide exposure through organic foods can support overall health, although more research is needed to fully understand its impact on ADHD symptoms. In conclusion, incorporating dietary changes tailored to individual needs can complement traditional ADHD treatments and improve symptom management. However, it's essential to remember that dietary adjustments may vary in effectiveness from person to person. Always consult healthcare professionals for personalized guidance and monitoring. In this exploration, we've seen how artificial colors and preservatives, gluten sensitivity, iron deficiency, low blood sugar, and organic foods can each impact ADHD symptoms. Nutrition truly plays a crucial role in managing ADHD, and understanding these dietary factors can be a significant step towards better symptom management.
Ever wondered what the best treatment options are for managing ADHD? Well, the answer is not one size fits all. Different people respond to different methods, and oftentimes a combination of approaches proves to be the most effective. Here's a breakdown of some common treatment options. Firstly, medication. Stimulant medications are often the first line of treatment for individuals with ADHD. They help to balance out slow brainwave patterns and can normalize symptoms. Some of the most common medications include Ritalin, Adderall, and Concerta, which are known to improve focus and control impulses. In some cases, doctors might prescribe antidepressants or anti-anxiety medications to manage additional symptoms. Secondly, lifestyle changes. This might include dietary adjustments like choosing whole, organic foods or specific eliminations like gluten or artificial additives. Regular exercise is another great way to manage ADHD symptoms, boosting beneficial brain chemicals and reducing restlessness. Consistent routines can provide a sense of stability, and prioritizing adequate sleep can drastically improve overall well-being. Thirdly, therapy. This can be an invaluable treatment option for children and adults alike. Through therapy and counseling, patients can learn coping mechanisms, behavioral skills, and strategies to boost self-esteem. Biofeedback therapy is another option, teaching individuals to recognize and manage their brainwave patterns effectively. Finally, nature therapy. Spending time outdoors, especially in green environments, has shown to have a calming effect and can alleviate ADHD symptoms. It offers opportunities for physical activity and sensory stimulation, which can help individuals focus and relax. So, in summary, managing ADHD is about finding the right combination of treatment options that cater to individual needs. Medication, lifestyle changes, therapy, and nature therapy all offer unique benefits and can be tailored to tackle specific challenges. Remember, it's vital to work closely with healthcare professionals to develop a comprehensive treatment plan. Because at the end of the day, managing ADHD is about improving quality of life and helping individuals thrive.
Have you ever wondered if there are alternative treatments for ADHD beyond medication? Today, we're diving into some of these options. First up, biofeedback. This fascinating method measures your brain waves and provides real-time feedback. By increasing awareness of your brain activity, biofeedback teaches techniques to improve concentration and reduce ADHD symptoms. Next, there's nature therapy. Ever notice how a walk in the woods can clear your mind? That's nature therapy at work. This method, also known as ecotherapy, provides a calming environment that promotes focus and relaxation, which can help alleviate symptoms associated with ADHD. Dietary changes also play a significant role. By emphasizing whole, fresh, and organic foods, dietary modifications can improve ADHD symptoms. Reducing sugar consumption and eliminating artificial colors, flavors, and preservatives can make a huge difference. And don't worry, working with a professional can help develop a personalized dietary plan tailored to your needs. Behavioral therapy is another powerful tool. This method teaches parents and children strategies to manage ADHD symptoms and shape positive behavior. Parents learn effective communication techniques and behavioral management strategies, while children receive positive reinforcement for appropriate behavior. Talk therapy, particularly beneficial for adults with ADHD, provides a supportive environment to address feelings and develop coping strategies. These sessions help individuals manage frustration, depression, and other emotional challenges associated with ADHD. Regular exercise is also key. It has been linked to reduced ADHD symptoms in children and adults alike. Physical activity helps regulate brain chemicals and promotes overall well-being, potentially improving attention and behavior. Finally, environmental changes can create a supportive environment for individuals with ADHD. Establishing daily routines, consistent bedtimes, and reducing clutter at home can help reduce stress and promote stability. Minimizing exposure to pesticides and other harmful chemicals can also reduce potential triggers for symptoms. By incorporating these alternative treatments into a comprehensive ADHD management plan, individuals and families can explore various strategies to address symptoms effectively and improve overall quality of life. Remember, it's essential to work with healthcare professionals to determine the most appropriate combination of treatments for individual needs.